Hey guys, this is Dr. Hub. Today we'll look at the structures which are related to the mediastinal surface as well as the hilum of the lungs. So now let's look at what lung are these two. So the one on the left will be the left lung and the one on the right is going to be the right lung. Now let's look at the prominent markings. So first there is a presence of the depression, and this depression is nothing but for the presence of the heart. So this depression is for the heart, and then there is a prominent curve. This, as we know, is nothing but the aorta. So this is nothing but for the aorta. That is a thoracic aorta. Next is there is again a esophagus which is towards the hilum. There is a structure that is the esophagus. So this structure is the esophagus. Now let's look at the hilum. What are the structures? So the one on the top will be the pulmonary artery, and the one in the other structure, this one is the bronchus, and the last one, which is in the bottom, this will include the presence of the PV, that is a pulmonary vein. Now let's look at the arches. This arch which is on top is going to be the subclavian artery, and the other one which is below it is going to be the left brachiocephalic vein. So this is nothing but the brachiocephalic. So what brachiocephalic? It is a left brachiocephalic vein, and there is also the presence of the rib which is present. So this is the presence of the rib. So this is about the left lung. Now let's look at some important points regarding the left lung. So as we discussed in the left lung, there is a cardiac impression. So there is a cardiac impression. So this cardiac impression, it is for the left ventricle, it is for the presence of the auricle, and also the RV, that is the right ventricle. Next is the presence of, there is a large groove that arches over the hilum and descends behind. So there is a large groove, and this, what it does is it arches behind the over the hilum and descends behind. So what does it include? That is the arch of aorta. This we already discussed the image. Let us write it down. The arch of aorta, as well as the descending aorta. Then there is a arrow groove that ascends to the apex. So there is a groove which ascends. So this ascending groove is nothing but the left subclavian artery. It is going to be the left subclavian artery. Then there is a superior to the aortic groove. What do we have? Superior to the aortic groove. So superior to the aortic groove, what we have is the presence of the thoracic duct and the esophagus. So this presence of the thoracic duct and also the presence of the esophagus. This is nothing but superior to the aortic groove. Next, let's look at the anterior to the subclavian groove. So what is present anterior to the subclavian groove? So the answer here is, it is the left brachiocephalic vein, and this we already saw in the diagram. So let's recap the diagram. So here in the diagram we saw the cardiac impression, and then there's a large groove which arches over the hilum and descends behind. That is there's an arch of aorta and the descending aorta, and the groove which ascends to the apex, that is a left subclavian artery. And next there's a subclavian artery as well as the superior to the aortic groove. There's a thoracic duct as well as presence of the esophagus. Anterior to the subclavian groove, there's presence of the left brachiocephalic vein. Now let's look at the right lung. So this is the right lung, and the important structures being there is presence of the right brachiocephalic. So this is nothing but there is a right brachiocephalic vein is present. Next, there is also the presence of the superior vena cava, writing it as SVC, and on the side there is a depression. So this is for the esophagus. This is for the presence of the esophagus, and there is a vein which is towards the side of the esophagus. This is known as the azygous vein. So this is nothing but the azygous vein. And let's look at what is present in the hilum. So in the hilum towards the esophagus we have the presence of the bronchus. So this is nothing but the presence of the bronchus, and then in between we have the presence of the pulmonary artery. So this stands for the PA, that is a pulmonary artery. Next, in the bottom, what do we have? In the bottommost, what we have is, it is nothing but the presence of the pulmonary vein. So it is nothing but the presence of the pulmonary vein. Now let's look at some very important points regarding this right lung. So the right lung anterior to the hilum, what do we have anterior to the hilum? So anterior to the hilum, what is present is the SVC, that is the superior vena cava, and also the right brachiocephalic vein. So there is a right brachiocephalic, there is a right brachiocephalic vein. And posterior to the groove, what is present? Posterior to the groove is the presence of the azygous vein. So this presence of the azygous vein which is posterior to the groove, and behind the hilum and the pulmonary ligament. So behind the hilum and the pulmonary ligament. So behind the hilum and the pulmonary ligament, what is present? It is nothing but the presence of esophagus. So this presence of the esophagus. Then comes the cardiac impression. So have we mentioned? No, we have not. So this area is known as for the heart. So getting back, the point to note is there is a cardiac impression. So let's write cardiac. So in the cardiac impression, what we are seeing is the right auricle. So there's presence of the right auricle, as well as there is presence of the right atrium and the right ventricle as well. Next, we look at posterior inferiorly what we have. So posterior inferiorly what we have is the presence of the IVC, aka the inferior vena cava. Now let's go back to the diagram and correlate what we have just seen. So anterior to the hilum is the superior vena cava as well as the right brachiocephalic vein. Posterior to the groove is the presence of the azygous vein, and behind the hilum and the pulmonary ligament lies the presence of the esophagus. So this is nothing but the esophagus. And the cardiac impression, there is a cardiac impression. This cardiac impression is, since it's the right lung, we have the right auricle, the right atrium, as well as the right ventricle. And posterior inferiorly, there is presence of the IVC, that is the inferior vena cava. So let's draw that inferior vena cava. The inferior vena cava lies here. So this is nothing but the IVC, inferior vena cava.